Our speaker today is Rebecca Kieth, family nurse practitioner, who obtained her undergrad and graduate degrees from the College of St. Scholastica in Duluth, Minnesota. Having spent most of her life in Wisconsin and actively enjoying the outdoors, ticks and insects are no strangers to her. Rebecca began paying more attention to Lyme and their co-infections by 2008. And after experiencing success in treating patients, she opened her own practice in 2010. Rebecca primarily sees patients in Minot, Wisconsin, but she has satellite offices in Menominee, where she travels monthly, and Pewaukee, where she travels bi-monthly. Rebecca is a member of iLabs, LymeDisease.org, and the American Academy of Nurse Practitioners. Rebecca utilizes integrative medical approaches in treating Lyme and the multi-system dysfunction which accompanies it. And I just wanted to add, for those of you that are familiar with Dr. Hoffman, Rebecca works with Dr. Hoffman. And he also is on my website. You can just type in Hoffman and up will pop. His is an audio file, if I remember right. But he's on my website as well. So if you want to see him and Dr. Green, Dr. Waters, my goal is to get as many practitioners in here as possible, because as you know, getting diagnosed is just the first leg of the journey. Then you typically have years of treatment, so you better like who you have. And it's not uncommon to change doctors, even often, because they all have their specialties, and sometimes you just need, you hit a bump in the road and you need another head in the game. And she's going to talk about mast cell activation syndrome. It's something I've wanted to write about, but I haven't yet. It's very complicated. But she's going to explain that today, and she's finding that many of her Lyme patients actually have this disorder as well. And so they improve when she deals with that as well as the infection. So welcome, and I'm so thankful that you came today. Anybody need a pencil to write? No? Okay.
Thanks for having me. Hello, everybody. Some of you I know very well. I have my family here, and some of you are all new faces, so cool. Welcome. How many people know a good amount about Lyme? Or how many people are, okay, well-versed, have it yourselves, somebody you know has it, you've been on the road, the journey for a long time. So nobody here is really new to Lyme, right? Okay, great. Because what I'm going to talk about today is, have you heard of mast cell activation syndrome? Yeah. Yes? Okay. Have you heard of mastocytosis? Remember the child in the bubble, the girl in the bubble, the boy in the bubble? So that was an extreme version of mast cell activation syndrome. That was a different kind, but along the same lines, just mast cell gone awry. And so what we're finding with many, many patients who have Lyme disease too, and I don't know which comes first, but that's one of the things that we're kind of trying to figure out is, well, basically we're trying to figure out how to fix this. And what it does is it calms down the whole immune system then once you diagnose. It's very difficult to diagnose. It's just like Lyme. So anyway, it was about probably a year and a half ago, and I had actually put this together for a PowerPoint, but I wasn't communicating very well with Alicia, so my fault. So I'm just going to kind of read off of what I had printed out for my PowerPoint. About a year and a half ago that I started paying attention to mast cell activation syndrome. I belong to a site where I have communication with about 600 other doctors worldwide, and so we often throw things out at each other, and mast cell had started coming up. And then I became familiar with Dr. F.N.P from the University of Minnesota, and who is the specialist who now has a waiting list of about 18 months if you want to get in to see him. So that's how common all of a sudden now mast cell is. It's probably been there for a long time, but we're just beginning to recognize it. And what a difference it can make for people to calm down that immune system and take care of a lot of those symptoms. So most of us who treat anything have like what we call an index patient. That first patient who came in and you went, aha. And so my first patient, and that's where I'm going to start, was a 10-year-old boy. And I had actually, he was a referral referral from another doctor. And he had spent the 10 days prior to the visit with me in a psych unit. His behavior had become completely out of control. By the age of 4, he was complaining. He was a healthy child, although he was born and had some stomach issues, some GI issues, suffered from constipation, was on Zantac as an infant in that first year of life. And then things calmed down, although mom said she kept him away from dairy because that was a problem for him. And by the age of 4, they started to notice behavior changes in him. Outbursts, tantrums, and of course you have to figure out, well, what's wrong with 4-year-old behavior, what's not. But he had met developmental milestones and was actually ahead of the curve on some of those, so that concern was dismissed. He was started to complain by the age of 4 to 5 of joint pain. That's when the mood issues began. So by the time he came to me, mom had been locking her bedroom door for a solid year because he was threatening to kill her, literally using the knife. So we had a lot of psych issues going on. He was not very kind to his younger brother, extremely not kind. The grandparents were encouraging mom to put him in some sort of an institution because they were so afraid he was going to hurt her. They had started treating him for Lyme. He had tested positive for the providers that he had been seeing. He tested positive for MRSA. He had parasites through Dr. Stata and I think Galaxy too. He had blastocystis homonosis from Dr. Stata. He had a history of lice infection, Bartonella quintana, and Bartonella Hensley. So he had a slew of things already going on. And as you all know, it's never usually just one thing anyway. So when he came into my office, the clue was, mom said, you know what, when I give him Advil, it seems to calm down his behavior. And when she gave him Benadryl, it seemed to calm down his behavior too. And one of the things I'd read from Dr. F.N.P was, often that's a clue. That, if it's calming down the brain, the psych stuff, that can be a clue that you might have mast cell going on here. So this very out of control child who I couldn't even do a physical exam on at that first appointment. Mom had to have grandma and grandpa come with in the car to restrain him. It was a 6-hour drive. They brought him up to see me. And it was just one of those awful, sad cases. So 4 days after I saw him, I thought, I wonder, because there's not a good way to test, and we'll talk about that too for mast cell. There are a lot of tests that I do like to use, but rarely do I get the answers I want through testing. But anyway, so 4 days afterwards, he was actually back in school and had calmed down a considerable amount just by using a histamine 1 blocker and a histamine 2 blocker, and then some Singulair, which will help calm down the mast cells as well. So that was just the beginning of the journey, though. And since that time, he also had parasites, which is also something I want to touch on if we have time after this presentation, just a little bit, because we're finding parasites are playing a very huge role also in psychiatric issues as well as GI issues. So again, you have a compromised immune system. What do you have? You have a major body system dysfunction that can present almost as anything. And you can't have your Lyme blinders on. Betty Maloney told me that at the very beginning. Do not just think Lyme, make sure you ruled everything else out. The good thing is by the time people usually find one of us who treat Lyme, they've been to many other specialists. They've been to every specialist. They've been to numerous specialists. At least 70% of my patients have been to Mayo. So anyway, so mast cell activation syndrome, MCAS, comprises disorders characterized by accumulation of genetically altered mast cells, basically. That's what it does. It causes much immune system-related issues, very diverse. Affects potentially every organ system of your body. Sound familiar? Huh? Typically does not cause abnormalities in routine lab testing. You have to look for this very specifically. Or radiological testing. The diagnosis is possible by non-invasive investigation. It is now considered to be prevalent in approximately 10% of the population. And if you think about it, I mean, even asthma is a mast cell disorder, right? It's just sort of the beginning of something going on. And hopefully if that person has a strong enough immune system, they're going to be able to the immune system will right itself, which is what we always hope for. The body's great at maintaining homeostasis, but when it's overburdened, it just can't do that anymore. And we see that with our patients who have Lyme. And of course, Lyme is a broad category statement for every one of the co-infections that can possibly happen too, which is why I also like calling it something else. Because you have Bartonella, you can have Babesia, you can have Rocky Mountain spotted fever, you can have Anaplasma, Ehrlichia, you can have parasites, you can have things that we don't even know yet. We haven't figured out everything that they carry. And that's going to be an unraveling that's going to continue probably throughout the course of our lifetime. It certainly, mast cell affects children and adults, should be considered routinely in the differential diagnosis of patients with multi-system health issues or those with whom a definitively diagnosed major illness does not account for the entirety of the patient's presentation. Symptoms may come and go. People can have it for decades, for years, just like Lyme and co-infections. You can have it for years and years and years and decades and never have a diagnosis. Certainly may present with symptoms in infancy or childhood. Prognosis is not understood. There's no consensus on diagnostic criteria. Treatment is available, but it's a lot like treating Lyme and co-infections. Everybody is different. I've been treating it for over a year now, and rarely do people respond exactly the same to the same medications. I can have a child on 50 milligrams of hydroxyzine 3 times a day, which will put somebody else totally asleep. It's way too much. So everybody, again, is very, very different. We suspect there's a familial causality. It's not necessarily genetic at this point, but Dr. Afrin does believe that there's something that is passed on that will trigger mast cell. We know that infection and stressors, much like can cause symptoms, exacerbation of symptoms with Lyme and co-infections, can also trigger mast cell. We suspect there's reactivity to increased environmental toxins, mold, pesticides, chemicals, preservative-laden foods, commonly associated with Lyme-related toxins, mold, parasites, and biotoxins. Okay, so mast cells, present throughout our body. Their principal job is to protect us and to alert us when our body's being bombarded. When the body's under attack, the mast cell secretes chemical mediators such as histamine, which is the big one that gets all the attention. That's at this point why we're using histamine blockers. Histamine 1, histamine 2, and histamine 3 blockers are on the way. We're doing research on them now. But they also secrete interleukins, prostaglandins, cytokines, chemokine, and various other chemicals that are stored in the cytoplasm of the cell. These chemical messengers can create local and systemic effects. They increase the permeability of the blood cells, of the blood vessels, causing inflammation and swelling. What happens when you get stung by a bee? You know, that's what happens throughout our body. So nice inflammation going on there. Not necessarily that extreme, but so it causes the permeability of the blood vessels. It causes contraction of smooth muscle as well. Stomach cramps and heart palpitations. Think of how many people who complain about those kinds of things. And so that certainly could be Lyme. That certainly could be Bart, because Bart loves your GI tract. But what if it's mast cell? What if it's not all tick-borne? What if we can calm it down? It's probably related to infection and stressors, but what if we can calm it down using the mast cell and antihistamine medications? It certainly causes increased mucus production, and we know that if mast cells go awry, there goes the immune system. So mastocytosis is a rare form of mast cell activation disease, and that's been recognized since the 1800s. Features not only inappropriate mast cell activation, but also inappropriate reproduction, growth, proliferation of mast cells. Basically, you become allergic to life, and that's the people that we've known who were like in the bubble. I remember hearing about that when I was a child. There was a boy in a bubble, and I didn't know what that was, but I had this visual. This poor child who was allergic to everything. Only the mastocytosis is a much more extreme case and much more difficult to control symptoms. So histamine. Histamine is a mediator that's produced and released by mast cells and other cells. It binds to histamine receptors on the surfaces of various cells, including mast cells. It causes a variety of symptoms, including itching and swelling. Has anybody ever had that happen before? I'm just curious, how many people here have Lyme? Okay. Do you itch and swell sometimes? Okay. Parasites, interestingly, so it's so tough to really figure it all out, which is why it's difficult for us, and why we really need several good minds working together. Because even those of us who treat Lyme and co-infections, we need other people to talk to help figure out each patient. You know, that's what you get in mainstream medicine. You get a team to work together. And it would be so nice if we could do that too. And so I know that we do that among ourselves, those of us who treat, but it would be so much more helpful because somebody sees something different in this patient than I see. And I need that information to help me put that whole picture and puzzle together. But anyway, so there's so many different variables that go along with treating mast cell Lyme, everything. So yeah, that's why it will often take several people to really get you back on track when you have Lyme. None of us feel offended for any, by any stretch of the imagination. There are at least 5 types of histamine receptors, H1 through H5, but H1 and H2 seem to be the most common, and like I said, now they're paying more attention to H3, and they are working on developing drugs to begin to block those. So diagnostic criteria, I'm not going to go heavy into this, but Dr. Afrin belonged to a group of experts who have helped create a simpler way to diagnose mast cell activation. And basically, he was working with a university in Germany that talked about the major criteria as being a multifocal mast cell aggregate, such as per the World Health Organization's diagnostic criteria for systemic mastocytosis, and then the clinical history consistent with this aberrant mediator response. Then they also talked about using the lab work, which gets, we'll talk about that as well. Also, detection of known activating mutations in mast cells in the blood, bone marrow, extracutaneous organs. It certainly affects the skin. It has a fair amount of issues with the hematological system, which is our blood, the GI system, and our skeletal system as well. So the tests that we're looking at doing for mast cell, we look for an elevation in the serum tryptase, and typically speaking, when you have mastocytosis, the extreme version of it, that tryptase is always elevated. Unfortunately, it's not with mast cell activation syndrome. When I first started testing people, I think maybe 1 in 10 had an elevated tryptase level, which would have been a nice way for me to determine they really did have it. But so that isn't reliable in itself. So we're looking at chromogranin A, plasma heparins or histamines, urinary and methylishistamine or other mast cell specific mediators, and some leukotriene tests too. But the difficulty with testing that I have found is that the blood work has to be drawn into chilled containers, has to be spun down in a chilled centrifuge, it has to be maintained at a chilled temperature, or the mediators will disappear completely, and then there will be no sign there's anything going on. And And there are only a few labs that are that cautious and careful with it. So this, again, presents another problem in trying to figure out who has it and who doesn't. So we know that mast cell certainly affects our immune system, also affects our neuroimmune system, because our glial cells, which are cells in the brain, also have mast cells. So this young person that I was treating and still treating, those psychiatric symptoms that he presented with, I mean, it sure makes you wonder. We know that Lyme affects us, it can affect us psychiatrically. We know that Bartonella certainly does. We know that Babesia certainly does. So now we have one more component. Well, we know parasites do, nematodes, and now we also know if it's mast cell. So, you know, I mean, gosh, our body is like majorly under siege. Some of the symptoms of mast cell. Where's Verascano's checklist? Basically, seriously. The first time I started looking at Dr. Afrin's work, I thought, well, these are all symptoms that my patients present with all the time. These are all symptoms of Lyme. Then the more I looked at what he was writing, he said, well, infection and or stressors can trigger mast cell. So we don't know. I mean, I'm just hypothesizing. But, you know, is that one more component? This is one more piece of what Lyme does to us? Or is this here first? There's a familial component, and it's suppressed our immune system, and we're more likely to contract and not be able to ward off Lyme and co-infections. So lots of questions. We don't know. Some symptoms of mast cell: temperature anomalies, fatigue and malaise, severe at times, unprovoked sweats day and night, decreased appetite, changes in weight, throat clearing, mild hoarseness, dyspnea with minimal exertion, chronic mild pendant edema, bruisability, slowness of healing, cognitive dysfunction, allergies, pruritus, rashes, sores, hives. People that develop hives after pretty much anything, all the people who are allergic to that, you know, there's that long list of medications, environmental issues, food issues, diarrhea, constipation, clotting disorders. Heparin was the first mast cell mediator to be discovered. Thus, mast cell disease was a potential cause of abnormalities in the clotting system. Pain, elevated eosinophils, dermatographism, the light scratch test on the back that stays there beyond 10 minutes, 15 minutes. That's a nice little sign. Presyncope, lightheadedness, wooziness, dizziness, vertigo, food sensitivities, dysmenorrhea, and there's still more. Mood swings, anxiety, hallucinations, suicidality, homicidality, hypomania, obsessive compulsive disorder, paranoia, bipolar affective disorder, muscle atrophy, anomalies in senses, hypomagnesemia, I can't say it, decreased platelets, increased platelets.
What did you say? Increased platelets or?
Decreased platelets and increased platelets. Pretty much everything that Lyme can do too, you know. Increase in mean corpuscle volume, chronic variable immunodeficiency disorder, urinary tract dysfunction, hair thinning and hair loss, dental and periodontal deterioration, eye-related issues. We've noticed that autism increase occurs nearly tenfold in children with mast cell activation syndrome. So here's one more thing that might be linked with our autism increases, kids on the spectrum. Osteopenia, osteoporosis, lymphadenopathy, leukopenia, anemia, epistaxis, tics, hypermobility, elevated CK, POTS, Ehlers-Danlos syndrome, which that was, you know, I've always thought there was a connection somewhere. Interstitial cystitis. And when I read this, and there's actually a specific medication, because how many women deal with, you know, with IC, and it is so miserable. pseudo seizures, positive lupus anticoagulant tests, MTHFR mutations. Okay, is that enough? You know, so pretty much anything can happen, but again, it's about your immune system. If your immune system's on fire and your body's releasing all these inflammatory cytokines, of course anything can happen. Calm them down, calm them down. So what do you do to calm them down? Well, you know, pay attention. I was walking by somebody today, we were over at Rutabaga's Cornucopia, which I just love to do. It brings me to Madison well, no, not every year. We were talking, it's probably been 4 years since I came to it, but it's always been something that I got to come down with my kids and family thing. So I'm doing that this weekend. But I was walking by somebody and I thought, holy cow, that strong cologne you're wearing, you know. Okay, so the smells, the lights. I said to Alicia, are the lighting, is this going to bother people? But we've got enough natural light, so that's probably not an issue, right? So different foods that you eat, cheese, chocolates, cured sausages, nuts, tomatoes, I suppose any of the nightshades, strawberries, citrus fruits, sauerkraut, spinach, fish, and then back to the aromas again, you know, different things that can trigger mast cell. So treatment, the good thing is that there are a number of histamine 1 blockers and histamine 2 blockers that are out there. And so one of the first that I started playing with or using was hydroxyzine, which can be a little sedating for some, but not necessarily for everybody. Again, we're back at that, what works for some people might not work for other people. Claritin, over the counter, might work. The average dose, the over-the-counter dose is 10 milligrams. But, you know, according to Dr. Afrin and according to what I've been experiencing, we will go higher than that. Allegra, Zyrtec, Benadryl, good old, you know, diphenhydramine, which can be used IV too, which is pretty nice if you have an acute situation with it. But of course that's going to just, you know, make you pretty sleepy too. Doxepine. And then H2 blockers, we have Pepsid, Nizatidine, Cimetidine, Ranitidine, and then different doses of those. And then mast cell stabilizer drugs, Cromolyn, which isn't well absorbed orally at this point, but it can be used compounded for helping heal wounds, which is something that I hadn't thought of before, which is a great idea. It's also available as a nasal spray, an eye drop. It can be inhaled, but there are compounding pharmacies that are making it. Pentosan, which is for the IC, for interstitial cystitis, to calm that down, and which is, IC has just become, we've just become aware of the fact that is a form of mast cell. Q-Certain, which is over the counter, it's a supplement. That can be used as an anti-inflammatory. Hydroxyurea. Then there are leukotriene inhibitors such as Singulair and Accolade. And then there's tumor necrosis factor drugs, tryptase inhibitors, and the H3 receptor antagonists are in the development right now. So, so Dr. Afrin himself says, this is pretty interesting, this is one of his questions. He says, is the mast cell behavior seen in patients a result of fundamentally normal mast cells reacting normally to known and or unknown provocations, or a result of fundamentally abnormal mast cells reacting abnormally in response to provocations and or acting abnormally in response to no provocation at all. So we just don't know. There's so much we don't know. And one of his big questions is, he's a hematologist. This is what Dr. Afrin does, hematologist. Does mast cell activation syndrome play a significant role in myelodysplastic syndrome, which is a precursor to acute leukemia, which is when the blood cell development goes awry in ways that typically lead to reductions in the production of healthy red blood cells, white blood cells, and or platelets. typically thought that most cases of MDS are related to mutations, but 50% of the time, no mutations can be found. So I think, I would not be surprised that he is onto something pretty big here. And then this is just my list of references. So, questions were small, big.
What is IC that you referenced?
Interstitial cystitis, inflammation of the bladder, very uncomfortable, relentless, urgency, frequency, pain, just very inflamed, very inflamed. Wow.
I had a question, hang on. Forget what it is. Hang on. Oh, you say symptoms come and go.
Mhm.
What's the kind of the theory behind that? Why wouldn't it be, is it just because the immune system at times is on top of it and then at other times it's not?
I don't know that we know, but it would be much like with Lyme symptoms that come and go. Are there more stressors in your life at certain times? What are you exposed to in your environment? There are a lot of questions going on right now, just even the longitude that we're living in. If we go south, a lot of people feel better. So that would make sense, well, yeah, psychologically, right. But it's, even with kids, different areas, people are just going to feel better. So there's probably numerous things that we just don't know yet. Yes?
I was just raising my hand because I was just in Florida a few days ago. Some of my aches and pains.
Right? No,
Upper
I
back.
have a number of patients who in fact, a patient of mine saw a new doctor, neurologist, who said, put him on very, very high doses of D3 and said, get as far away from here as you can, go south as far as you can. Because he goes to Florida with his family and everything goes away. And that's not just psychological. So then as soon as they come back up here, they're hardly out of the car and they're, back to their old miserable needs. So mast cell is definitely a player in this whole issue of chronically ill people. And I think we're going to be paying a lot more attention to it as time goes on. So you can all do your research. There are some interesting books out there. You can find them on histamine intolerance. And I think it'll be interesting to see what kind of research they're going to be doing. Fortunately, with Dr. Afrin, he's associated with the University of Minnesota Hospital, which is fabulous. And he's very, very helpful and very, very informative.
So you want to explore this with your current doctor? And I know you again, there must be some tests that you can do to determine that. What would you suggest you do, or how do you present this to your current doctor, and what do you ask for?
So I can, we can get you a list of the labs that you need, and you can take it to your physician, and you can bring up mast cell. It's dismissed by many physicians still as a real health issue or diagnosis, but we fortunately have people in mainstream who are paying attention to it, taking it seriously. So bring that to your physician. But again, the biggest issue is that the specimens have to be handled appropriately and kept chilled. Otherwise, you're not going to find anything. And it doesn't take much for those mediators to disappear once the temperature rises. So it has to be very, very chilled.
So does this fall under immunology? Is this, and do they know if you're born with this dysfunction? Is it genetic?
Well, I think what they're thinking now is that it's not a true genetic mutation, but there's a familial familial causality. There's some connection. So, you know, when I think about that, I think, well, okay, so if I have Lyme and I give it to my children, are they more likely then to have a dysfunctional immune system? Yes, right? And then it is dependent on whatever then they're exposed to, including reinfection. You know, I mean, I guess you could, let's talk about vaccinations, you know, let's talk about the food we're eating, let's talk about where you're living and what air are you breathing. Let's.
So there's an epigenetic.
Absolutely.
into this.
I'm sure they're going to realize that.
If you have a lot of other allergies, is there maybe a link, or do you suspect maybe there's?
Oh, sure, because if you have an allergy, it's because your body's releasing your mast
already
cells.
had a messed up immune system.
Sure, well, could mast cell be one more piece of that?
Yeah.
Absolutely, absolutely. And the key is too, don't, you know, if a person starts on any of these mast cell medications and they don't seem to make a difference, there are more. Because like I said, the experience I've had now in the past year is the meds that work for one person might not necessarily work for another person. And it's one more time-consuming issue, you know, for us to try to figure out. But it's a piece I think is pretty important, because if some of your symptoms that we're saying are Lyme symptoms really aren't Lyme symptoms. They're more related to the fact that you've just got too much histamine going on, inflammation, which is what we're looking at a lot of times with cytokine testing. We see that. So then if we calm this down, you know, what will that alleviate? And the list of symptoms is as long as our list of symptoms for Lyme. So there's a link. Stressors, infection, cause immune dysfunction. Mm-hmm.
So they're totally separate entity, mast cell, Lyme, but symptoms are, they parallel each other.
Well, I think there's a link. But at this point, because if you have chronic Lyme co-infections, you have a compromised immune system. It's a given. So with a compromised immune system, you're going to have more issues anyway with inflammation, with mast cell. So you're going to be more likely to have increased resistance to anything else in the environment, your foods that you're eating. Your immune system just isn't what it needs to be.
So there's a definite crossover in the connection spot.
So your treatment approach then is the same that you would do for Lyme? I mean, it sounds like you can treat it, I guess, with the histamine and other medications, but you're not really getting to the root.
Right. Right. So, and if you read Dr. Afrin's book, and there's, like I said, there's another book out there called Histamine Intolerance that I've read parts of. It was written by a woman, I think it's a book by a woman from Germany. I'm not going to say that Lyme disease causes mast cell activations, but knowing that there's some suggestion that it can be brought on by infections or stressors, well, you know, and the amount of it I see in my practice, and the symptoms don't all go away with mast cell treatment, but it makes it more clear to see, okay, you know, we calm this down, these symptoms that we're thinking are Lyme symptoms, they might really be secondary to Lyme, but I don't need to use those medications to treat that. I can use the H1, H2 blockers, mast cell stabilizing medications to do that. But again, there have been a few people that I have started out on mast cell meds without any antibiotics, just to see what would happen. And of course, they know they're kind of part of the trial. So it's been very interesting. And this little person who I used, my index patient, was one of them. I said, let's just do this first. Let's calm down his poor system before, and then it'll make it more clear to see what do we really have going on here. by the way, a year and a half later, he is doing great. But we also treated parasites, which is something I'd like to just touch on a little bit too.
If I could just add, when I read Dr. Afrin's book and started looking into this topic for myself, at first I was under the impression that you had to have like allergy type things. So I was looking at my daughter who had severe Epstein-Barr virus. I mean, like, she was horrible. And where most people would recover in months, you know, a year out, she's still got swollen lymph nodes, she's still catching every virus. So my Lyme doctor was kind of considering this, and he approaches it with the LDA, LDI shots, and I know Rebecca said that some people have really kind of bottomed out with that approach because it really is a lot for their immune systems to handle. But I just wanted to tell you my daughter's story because there seems to be quite a pendulum on this, and she's over here more where she would get what you would think would be acne, but it wasn't. It was painful under the skin. Then she'd go in for her LDI shot, and within a day, it dried up and completely went away. For those of you that don't know what LDA, LDI is, you can type it into the search bar on my website, and there's a great article. It's basically, if I had to do a real quick summary, it's kind of like treating allergies, but differently. You get sub-Q shots of little bits of this and that, and trying to get the dose for each person correct is kind of the key to the whole thing. Whereas like allergy stuff, you would keep taking the doses up higher and higher till you almost reach that anaphylactic threshold. LDA and LDI, you don't do that. You try to find that sweet spot where the person gets better. Well, it's really working for my daughter, but we often wonder if it isn't some of this mast cell activation syndrome that we're dealing with. But like Rebecca said, everybody responds so differently. Where one person might respond fantastically to Allegra, another person doesn't notice a thing, versus aspirin might help some, and like with my daughter, these LDA shots are helping her. So it really is like, you have to be Sherlock Holmes with this stuff and just keep going down bunny holes till you find what helps a person. But what I find interesting about this is, it could be that thing that a Lyme person needs to discover, because they can keep throwing antibiotics at themselves and they don't get better. And we do find that, don't we? That a lot of us, we keep going after the microbes and we might still be having some pretty severe symptoms, and it might be this.
Well, and important too to think about the co-infections. You know, Bartonella loves your GI tract. It gives you swollen limbs. It makes the bones of your feet hurt. It affects your muscles and tendons. What does babesia do? You have frontal headaches. You got some clotting issues. You have night sweats. I mean, it's so difficult. So it really is, how do you respond to the treatment? How do you respond to the medications? What goes away? You know, the analogy is, it's like peeling the layers off an onion, but it's so true. And the other thing is you have to take away a lot of those stressors. You have to clean up your diet. You know, people don't want to do dairy-free, gluten-free, corn-free, soy-free, but you have to, because that takes the inflammation down. So it helps your body recover. It brings up your own immune system. So there's a fair amount of accountability in here too, and some people don't want to do that, but that's really important. You know, and then throw a little exercise in there, make sure you get in your sleep. But we all have crazy, busy, stressful lives, right? Anybody in here not? So there's so many things you have to pay attention to. And that's the good thing. I don't mean good thing. There's nothing good about having any of this, but it does make us pay attention to ourselves a little bit, and we need that because we are responsible for our health.
So are you promoting the caveman diet, is that true?
You know, shopping around the periphery of the grocery store, not a bad idea. Eat your vegetables, eat your fruit, have your protein sources. Sugar is very inflammatory. Carbohydrates are very inflammatory. anything that will turn to glucose in your body is very inflammatory. And we've known that for a long time. But, look at our diabetes, look at our heart disease, look at our, look at our bodies inflamed as they are. So,
Well, there are good carbohydrates as far as,
complex carbohydrates.
so you're not moving up.
I'm not gonna say don't eat them, no, but our breads and our gluten, a lot of people, you just have to use some common sense and then balance it out. I think that there's variations on, and for one person, what works for one person might not be the food that works for another person either, so. And what I've noticed really is that every generation seems to be dealing with this differently and more difficultly. I watch my folks eat just about whatever they want to eat. My dad's going to be 82. He loves popcorn and peanuts. And I'm like, no. But he's going to be 82 years old, and sugar. My mother's always baked for him to keep weight on him because he was a very active person. So that won't work for my kids. That won't work for me, popcorn every night, no. Big gallon of butter's okay. You do the butter. But anyway, so each generation has less tolerance, I think, is what we're seeing. And I think it plays a big role if you have overall body inflammation, which a lot of our young people do. They're reacting to the preservatives now, to the food coloring, to the different diets. Look at the kids, look at our school lunches, for crying out loud. That's another whole big soapbox I can get on, but there's nothing healthy about what we feed our kids. And if you ask the teachers, they don't eat that stuff.
No.
They don't.
No way.
It's awful. Fresh out of a can and full of corn syrup.
I did some research on permethrin, which is used for deterrent. It's most commonly found in lettuce.
Naturally?
No, apparently they use it to
Oh.
spray the bugs on the lettuce or eating it.
So that would be like a natural tick repellent then that we're ingesting.
Yeah.
So,
Very systemic.
yeah. Well, and go back to organic, because we're not doing that then. So that builds up in the bodies and the brain of our little people, because we think we're giving them healthy food, right? Yeah, no, we don't, I don't know, it's sad. It's
Alcohol goes on everything. I'd say we won't have worms till they become around that way.
Well, their numbers are going down, for sure.
Well, tell us about parasites, we're dying to know.
Brain on fire. So parasites. Dr. Alan McDonald came out with some research at the beginning of last year, and he looked at spinal fluid of a number of, I believe it was 20 patients who had died from glioblastomas, which are pretty significantly malignant brain tumors, Lewy body dementia, and patients who had died from multiple sclerosis. And of the tissues he looked at, he found nematodes in them. And he was sort of stumped because he hadn't seen nematodes before, but the reason was because when we're looking for Borrelia and we're looking for Bartonella, we're magnifying by like 40 to 50 times. Well, these, he had brought the magnification back down to 10 times, and there he found these nematodes. So he had seen them in the past, but it was the background. So when he looked in the nematodes, he found Borrelia bacteria as well. So if the nematodes are in our spinal fluid, and he did find them in the brain as well, and we know, and if you look at what Dr. Bransfield, who everybody know Dr. Bransfield, one of our brilliant psychiatrists who treats out east, And he treats people with mental illness. He's a psychiatrist. He treats our Lyme patients with mental illness. And he has definitely noticed improvement with anti-parasitic medications. Has found there's obviously a lot of Toxoplasma gondii, which, you know, we don't live in a third world country, so we don't typically think that we can have a problem with parasites. And they're difficult to test for. They're very difficult to test for. But some of the specialty labs may find things. The local labs, we really aren't, they're not covering enough of a broad basis of looking for, and they don't really know what we're looking for. They're only looking for a few different things. We don't really know what all is in these people. But since I have been treating people for parasites, it is nothing short of amazing, the improvement in them and what is seen that they're expelling. It's like, seriously, I had to really prepare myself to do this. Anyway, but people are getting better, so there again, it's one more piece, but it makes sense. You have a compromised immune system. We've all been exposed to a million things. I've been a nurse for a very long time. Heaven only knows what's in my body.
Correct.
So as long as my immune system stays up, I'm gonna be okay, hopefully. But if I go down, what am I gonna have? Who knows? You know, that's the bottom line. So you have to keep your immune system up, which is why it all goes back to that whole eat healthy, get a little, get exercise, take care of yourselves, try to stay away from the stress, and then find somebody who knows what the heck they're doing for treatment, because it's not any one thing that is taking you down. It never is. I shouldn't say that. I should never say never, but it's usually a variety of different issues